You ready? All right, so we're gonna go ahead and move to your physical exam. I'm gonna go ahead and get started with your blood pressure. I'm gonna pull this up. While we're doing this, what's your name?
Omid.
And what are we doing here today?
Physical exam.
And where are we at?
Western University of Health Sciences.
Okay, and what's the date?
28?
27, close. It's okay, I'm horrible with that too, don't worry. All right, so go ahead and relax your arm. You have pretty good blood pressure. It's about 122/80. How's that for you?
That sounds pretty normal. I mean, not normal, it sounds not good either.
No, it can't be normal and it can't be good. I'm going to go ahead and take your pulse. Go ahead and just relax for me. Okay, so your breathing's at about 12 breaths per minute, and your pulse was 18 beats, which I'm going to do the math on later because I can't do it in my head right now, times 4. So I'm going to come over and write those down because otherwise you're going to forget them. Does that make sense for everybody? Okay. While I'm here, I'm going to go ahead and palpate just your pulses for equality. Good. Can I go ahead and have you slide this way so I don't step in front of the camera and turn towards me? There we go. Okay, so I'm going to go ahead and move into your head evaluation. I'm going to take a look. Can you bend down for me so I can look at your head? And I don't see any scars or lesions. Is any of this tender?
No.
Okay, go ahead and look back up. Does this hurt?
No.
And how about here?
No.
How about this?
No.
None of that hurts. Perfect. Okay, I'm going to go ahead and have you follow my finger. Go ahead and look straight. Keep your head straight for me. And follow it with just your eyes. Good. I'm going to go ahead and come behind you. Okay, go ahead and look forward. Let me know when you see my hands.
No. No.
Okay.
No.
Good. Okay, I'm going to go ahead and look in your eyes. Oh, it has an otoscope tip. Good. Okay, so I can say Perla EOMI. I can go ahead and say I'm looking at your eyes. The sclera look clear. I don't notice any redness. Have you had any discharge or anything like that?
No.
Good. I'm going to go ahead and take a look in your eyes. Somebody's got to throw me an otoscope tip or we're not going to be able to do this. You stay. Okay. So I'm going to go ahead and look in your eyes real quick. Kind of look straight. Okay, and I can see your vasculature. Good. Okay, so your eyes look good. I'm going to look in your nose. Haha. We're lucky I can catch today. I'm going to do your ears first because I can't go your nose to your ears, but I can go your ears to your nose, remember? Go ahead and turn that way for me a little bit. Good, and your tympanic membrane is pearly and white. Go and look the other way. Sorry, I know I'm right in your camera view. All right, everything looks good there. I'm going to go ahead and look in your nose real quick. Okay, tilt your head back. Good. Do you notice how uncomfortable it is if I move around?
Mm-hmm.
Yeah, so don't move around. Base it on their bottom of their nostril and then hold it put. Go ahead and open your mouth and say ah.
Ah.
Okay, just throw it foot and mouth looks good. I'm going to go ahead and pull underneath your lymph nodes. Let me know if any of this is tender. Nothing? Okay, I'm going to come behind you. When you're behind your patient, I would walk and stand behind them. Sitting on the side of the bed is not okay. Go ahead and swallow. Good. That feels good. I'm going to go ahead and listen to your heart, okay? Normally, I would have the patient do what? Lower their gown. Make sure you're on skin. Okay, everything sounds good. Go ahead and take a deep breath. Okay. Good. I'm going to do the same thing from the back. Now listen on this side. Go ahead and take a deep breath. And one more. Okay, I'm going to go ahead and percuss in those same places. I'm going to do the same in the front. All of this on skin. Good. And then I'm also going to do, while his gown is down, I'm going to take a look at the chest wall and make a verbalizing statement. I'm looking at your chest wall. I don't notice any abnormalities, etc. Can you go ahead and hold your hands out for me? I'm going to go ahead and check. I don't see any bluing. I don't notice any difficulties with cap refill. Can you push your fingers together like this? Perfect. And I don't see any clubbing. I'm going to come down and check for any tibial edema. Okay, I don't notice anything. Can I take your shoes and socks off?
Sure.
And if they have socks in your way, you have to have them take them off. Okay, so I'm going to go ahead and check your pulses. Good, your pulses feel good. While I'm down here, I'm going to go ahead and do your reflexes. He doesn't have good ones either, but I can feel him pulling his foot up. Relax your foot. There you go. There we go. Okay, and I'm going to go ahead and check your biceps as well, okay? Kind of relax your arm. There you go. Okay. Relax your arm. Good. So reflexes up in the uppers are 2+. You got a 1 on the right, left, and a 0 on the right. I wasn't able to attain it. So I'm going to check your sensation. Go ahead and let me know if you feel this and if it's equal on both sides. Do you feel this?
Yes.
How about here?
Yes.
Here? And here?
Yes.
Okay. So sensation is equal. I'm going to check your joints. I'm going to go ahead and feel, is any of this tender anywhere?
No.
Not anywhere down all the way. Okay. I'm going to go ahead and bend your arm. Okay. All right. So I don't feel any crepitus. I'm going to do the same in your knees and your ankles. Is any of that tender? Okay, go ahead and push out for me and pull back. Good. And I feel a little bit of a cracking in the knee. Okay, not on that side, so only on the right. Go ahead and put your arms up like this. Push out against me. Go ahead and pull back. Good. Go ahead and squeeze my fingers as hard as you can. Good. So you've got equal strength, 5 out of 5 throughout. Can you slide up and lay back for me? Okay, so abdominal exam. What would I normally have him do? I would drape him. I would have him lift. Then I would use the belly button as my location. So I'm going to look at the abdomen first. I don't see anything abnormal. I don't notice any bruising, etc. I'm going to go ahead and listen. And once I hear bowel sound, I can move. Good. Everything sounds normal. Good. And I'm going to go ahead and palpate. Let me know if anything's tender. Everything seems good. I'm gonna go ahead and have you bend your knees up and put them on the table. Good. Lift your butt up off the table and drop it. Good. Now let me move your legs. That's called a hip flop. This is one way to check extremities and where their leg length is, and everything seems normal. Go ahead and have a seat and stand up for me. Can you walk towards the door? Good. And when you walk back, can you walk back heel to toe for me? Maybe. You had as much trouble as I did with that. That's good. Go ahead and have a seat. What'd I miss? I did hearing, did I? I thought about it, I might not have.
I think you did, yeah.
I thought I did it and he said it was normal. Maybe not. Anything else? Pause it there.
You didn't do the tricep?
I only did biceps, so one upper, one lower. What else?
I said, I don't think you did hearing. You did the eye test from the side?
I may have not done the hearing. So hearing, if it's normal, so I come behind him. Can you hear this?
Mm-hmm.
Is it equal?
Yes.
Then I stop. What if he says no? Can you hear this?
No.
Very good. Okay. Can you feel this equally on both sides?
Yes.
Well, let me know when you stop hearing it.
No.
Can you still hear it?
No.
It's not good. Tell me when you stop hearing it. And this one you want to hit very softly.
No.
Can you still hear it?
Yeah.
Good. Okay? Because otherwise it vibrates for a very long time. Did I miss anything else? Okay, how long was it?